family. I've been thinking about Gucci Mane's recent Breakfast Club interview. Hearing him talk about transformation and discipline really got me thinking about how many people in our community are fighting battles that we can't see. Especially when it comes to mental health conditions like schizophrenia. No, schizophrenia isn't about being crazy. It's a serious brain disorder that changes the way someone thinks, feels, and experiences reality. Some common symptoms include hearing voices that aren't there, seeing things others don't, believing things that aren't true, or having disorganized or hard to follow speech. Sometimes folks start withdrawing from friends and family. They lose motivation or show less emotion, not because they don't care, but because their mind is simply overwhelmed. Here's something important to know. Symptoms often first appear between the late teens and early 30s. For men, that's usually the early 20s. For women, it can show up a little later. So when we see a young person suddenly acting paranoid, confused, or detached, it may not be drugs. Sometimes it's the first sign of schizophrenia. And that brings me to a big misconception in our community. The idea that somebody must have laced their weed. Yes, substance use can trigger or worsen symptoms, but schizophrenia doesn't come from being laced. It's a complex medical condition tied to brain chemistry, genetics, trauma, and stress. We have to stop blaming people or shaming them and start recognizing what's really going on. According to the National Institute of Mental Health, Black Americans are diagnosed with schizophrenia about 1.5 times more often than white Americans, yet we're less likely to get an accurate diagnosis or consistent treatment. Too often, symptoms are written off as attitude, defiance, or drug use when the person is actually in crisis and needs care. Getting diagnosed starts with seeing a psychiatrist or a licensed mental health professional. They'll do a full evaluation talking about symptoms, family history, and ruling out other medical causes. There's no single test for schizophrenia, but with the right assessment, it can be recognized and treated. Treatment usually includes a psychiatrist prescribing antipsychotic medication to calm the brain and reduce symptoms like hallucinations or delusions, along with a therapist providing counseling and a strong support system. It's not a quick fix, but with consistent care, people can live full and stable lives. Just like we take blood pressure medicine to protect the heart, mental health medication protects the mind. So if you notice someone hearing voices, seeing things, or seeming